and welcome to today's webinar, COVID-19 Update, What Employers Need to Know This Week. My name is Stephanie Matos, and I will be your host for today's webinar. Before we begin, I would like to remind the audience to please feel free to submit questions throughout the event via the Q&A box on your webinar toolbar. Our presenters will be answering questions at the end of the webinar. Any technical questions you may have will be addressed as soon as possible. With the COVID-19 virus's impact on people and businesses growing more serious every day, many companies are left trying to figure out their best options for how to protect their employees, balance business needs, and satisfy client demands. Join our presenter, Claudia St. John, as she helps us navigate through this tough time. Ladies and gentlemen, at this time, I would like to pass it over to Claudia St. John.
Thank you, Stephanie. You're the best. Hi, everybody. Nice to see you all again in week 10,080 of COVID pandemic. We are today going to be covering just a couple of areas that we've discussed in the past, and then some emerging thing. I think the important thing that's happening now is all of a sudden we're opening back up again, and that means that all of you who have been working as essential businesses who have been open, many of you probably have some staff that were home that you're now contemplating bringing back. You might have staggered shifts that you might be trying to figure out, do we go back to normal? Do we keep the staggered shifts in order to keep occupancy low? A lot of questions coming in about sort of now what? And also on top of that, the virus is still like right out there, right? So we're seeing the rates going down across the United States in most locations, but that's really because we've all been in. And so the question is, how do we now go out and keep our workplaces and our employees and our families and ourselves safe? So that's really what we're going to be talking about. A bunch of stuff has come up that we're going to be discussing, but just a minute about me. So I'm the president of Affinity HR Group. We're an HR consulting firm, and we're here to help small to mid-sized businesses, many of whom don't have HR. And it was funny, I was actually having a conversation this morning with somebody. We were talking about how we really have a newfound appreciation for our essential workers, which in many cases are our janitorial sectors, our restaurant workers, our grocery store workers, you know, the people that well, not the restaurant workers, but the people that are putting themselves on the front line, and they aren't really, you know, the people that we normally celebrate. The other thing that's been really odd is people are now saying, man, I need some HR. So this is, I think, a moment when having an HR person is a great resource. And if you don't have one, feel free to reach out to us. This is my contact information. Please link with me on LinkedIn. Everything that I'm sharing here today, I often push out on LinkedIn. We also have a very robust blog that has had all of our videos and all of our the forms and checklists and things that I'm going to talk about. We have those there. So if you go to our website at affinityhrgroup.com/blog, you'll see a lot of content. If you have an HR person, send them there, stuff that they can pick up on. We also have a very robust YouTube channel, and we've been putting a ton of content out there as well. So just check all of our resources and do link with me on LinkedIn. The only thing I want to say also is that we are not attorneys, and I am not a banker, and I am not an accountant. You would never want me doing any of those things. And so when we get to the part about the Paycheck Protection Loan, there's only so much information I can share, but I will share with you what I know. But any financial questions, you really do need to talk with your financial people, and any questions of legal matters, you know, we are not attorneys. We get 80% of the way there, but we're not quite there yet. So opening is happening. I'm going to move my camera off over there so that I don't have to look at myself. As we're opening up, it's really a piecemeal. We have a lot of states that are already open, those that out west particularly that never really closed. But then I'm in New York, so we are planning to reopen on a regional basis, but our numbers aren't where they need to be, so they keep delaying our reopen. But these reopens are a lot like the closures. They're very sort of haphazard. They are, sometimes everybody's open, and sometimes they're just doing construction. But all of the openings do require us to think about, how are we going to open? And if we can open, should we open? Because being closed has really been what has helped protect us. I mean, opening up for business, we need to remember, is really largely an economic issue, an economic concern, and a very, very real one. And boy, I don't know a single person who doesn't want to run out and get their nails done and their hair done and get a good meal at a restaurant, have somebody else do the dishes. But we're also doing that and having that opportunity with still a very real threat that's out there. So as folks are reopening business, they're having to contemplate quite a few things. The first thing they need to do is make sure that they know when they return their employees to work that they're aware of all of the symptoms of COVID, and those symptoms are evolving. So we see, it used to be, you know, a sore throat and a fever and a cough and shortness of breath. Now we're seeing things such as diarrhea and intestinal distress, loss of taste and smell. They have these things called COVID toes, which I don't even really understand what that is, but that's a thing. And actually the UK has listed insomnia as one of the criteria, which I know I have had insomnia the entire time, so maybe I have it, although I don't think so. But it's just really, really strange, all of the symptoms of this disease. You should be checking CDC and reading the newspaper accounts of potential symptoms, and make sure your employees know what those symptoms are. And if they have any questions or thoughts that they have any of these symptoms, they should go home and stay home until they resume. And we'll talk a little bit about returning to work. I did want to say one thing that we didn't say starting off. Please type in your questions. I'm intending to give you just about 25 to 30 minutes of content and then answer your questions. So if you have questions as I'm going through this content, you don't have to wait till the end. Feel free to type it in. And Stephanie, if it looks like I'm at a good place to answer those questions, feel free to interrupt me, because I want to make sure the purpose of this is to get you the answers to the questions that you have, as well as maybe make you aware of some new things. So if you're opening back up again, or if you've been open all along, make sure you are constantly reminding your employees of what the symptoms are. You should bookmark on your web search, on your browser, all of the federal, state, and local resources that you need to keep up to date on, so that you know what the status of things are for you. I strongly recommend those include the CDC guidelines for employers. EPA has a list that tells everything about what cleaning products are safe, what masks you can use that are appropriate for the virus. We also have OSHA is a site that you can see how to remediate your workplace and how to structure your workplace in order to maximize protections from COVID. Also on the state and local level, your health authorities or your governor's office, whoever is the responsible party for the closures and providing notifications of openings and closings, because we do kind of expect that it's not going to be a light switch that goes on. This is going to be kind of a faucet that we open up and close down a little bit, because we're expecting there to be peaks and valleys of infection. And so if you get a hot spot in your local area, you may have to go back into some form of shutdown. So just know that you should be keeping in touch with all of those authorities. And if you do have any infections, making sure you're following the appropriate required notification in your county or your state for COVID infections. If you have been closed, or even if you've been opened, now is a great time to contract with a professional cleaning organization, company, to come in and do a nice clean on your office. It'll make everybody feel better that they're entering a clean workplace, but it also will give you the opportunity of establishing a relationship with an organization that can come in and remediate your building or your workplace should you have an on-site infection. So cleaning and restructuring your workplace, most of you have already done this. I mean, there are lots of websites on how to do that, but you do want to continue to maximize that social distancing. So we've been guiding employers on things like looking at, they'll send us pictures of their workplace, and we've been recommending, okay, you've got a cube farm. I would not have everybody in this cube area. I would, if you could take out 10% of these people and then put plexiglass up between your cubes. You know, remediation like that. Also having designated bathrooms so not everybody's using the same bathroom. Have a little hand sanitizing station on either side of the bathroom door or any points of entry where you know that there's going to be a lot of traffic. Close close down your kitchens, get rid of your coffee machine, close up your refrigerator, all of the places where there are opportunities for people to, you know, go and get the sugar canister or get the creamer that you've got. All those places where people stick their fingers in, you want to mitigate those. Also, if you have a vending machine, that's a great place for you to have a sanitizing station and to wipe down all of those services. You want to make sure also that employees have a role and a responsibility for keeping their own workplace clean and cleaning the workplace, any designated areas that they will be responsible for. You want to make sure that your employees are not just using antibacterial soap or hand sanitizer, because this is not a bacteria, this is a virus, and it has an outside coat, it's a lipid, it's a fat, and that's why washing your hands with soap and water is the most effective, because that soap is what breaks down that outer shell, and once that shell is broken, the virus dies. So keep an eye on the products that you're using. Make sure you have plenty of those things available to keep your workplace clean. The more you do to show and to make it obvious that you are like vigilant about cleaning your workplace, the more your employees will feel comfortable coming there, because they know that you're keeping their health themselves. And as leaders of your organizations, it should be your responsibility to walk the talk, man. If you believe in social distancing, do not get any closer than 6 feet to anybody. And if you're going to have personal protection for masks and glove wearing, for example, you need to be wearing it yourself. You need to lead by example so that employees won't feel that it's optional, or worse yet, that it's frowned upon for them to take the necessary protections to keep themselves and you clean. So you do also need to make a decision on the use of PPE. So will you have folks wearing face masks at work or gloves? That is a very personal decision that depends on your geography. Do you have a lot of infections there? What kind of level of contact do you live in? Do you work in? How close are people working together? Can you socially distance appropriately? All of those are going to impact the decision to wear a PPE and wear those face masks. What I will tell you is that if you make the policy determination that you're going to have face masks at use at work, you know, people say, I don't want to do it because it's hot, it's uncomfortable. Well, nobody likes wearing this stuff. But right now, it's really our only line of defense against a deadly virus that we can't see and we can't fix, and we don't have anything to, no immunity, no treatment, no nothing. So, it's a very personal decision, and I understand it's also a very political decision, but it's one that you should make in conjunction with your needs and the needs of your employees, and you may find that while they don't like it, they'll probably appreciate that you're being super vigilant about keeping them healthy. You're also going to have a conversation about health screening, and I wanted to take a minute because we've had a big change about this. So currently you are allowed to take the temperatures of your employees, but previously the EEOC, Equal Employment Opportunity Commission, had said that you cannot require a COVID test because that's a medical procedure, and as a result of that medical procedure, you're not allowed to require that of employees. The EEOC has just made a change that says that you can, as an employer, require COVID testing, and there's also, that could include testing for the virus, but also testing for the antibodies. The problem is that our testing is terrible, and so our ability to get it is tough, and getting the right one is tough. There are a lot of false negatives that are out there. The antibody tests are giving false positives, which means people think they're immune and they may not be fully immune, and we don't even know whether the antibodies at this point are protecting people. But here's the deal with the EEOC guidelines. If you are taking the temperature and health screening of your employees, you now can consider doing COVID testing for everybody entering your workplace. The EEOC has said that it has to be done in a non-discriminatory way, and it has to be job related, but they don't tell us what job related means. So I would say if you work in a skilled nursing facility or a daycare or a healthcare facility, that obviously is very job related. Even if you're a janitorial company and you're going into people's workplaces, perhaps that could be job related. But there's really no determination of whether or not it would be job related if you work in an insurance agency or a floor covering distributorship. So we're not really clear on what this job relatedness means, but if you're bringing people back to the office and you're trying to protect from a coronavirus, then perhaps being job related, it would extend to that. So you would need to test everybody uniformly. So everybody, if you're going to test them all. The results have to be confidential. This is true for the health screening and for the temperature checking. You can have a health screen that asks every employee to self-report their own, any identification of symptoms, illnesses. You can ask them if they've had any of the symptoms of COVID, have been sick recently, have they had any temperatures. You can have that all recorded. You can take their temperature, but you need to keep all of those results confidential. If you find that somebody does test positive COVID, you have to keep that information confidential. So while the EEOC has opened up the door a little bit to allow you to go in and ask about people's health conditions where normally you would not be able to, you still have to follow HIPAA guidelines to keep that information confidential. You may need to pay for the time spent for your employees to go and get tested. So if they're going to go and get tested, I mean, clearly you're not going to be doing these tests yourself. I don't know why. It sounds like it's like root canal for your brain. But you want to go to the right place. You're going to need to pay employees for the time spent doing that if they are non-exempt and on an hourly basis. You need to be very careful about the test that you select, because if you have a false negative or if you have false results and you make an employment decision on that, such as to keep the employee home, to furlough them, whatever you do as a result, and if you test them as a candidate and they have it and you choose not to hire them, you need to make sure that the testing that you're using is correct and accurate to the best of your ability. So you need to do a lot of due diligence on what testing to use, and that also depends on what testing is available. You also have to have a thought of what you're going to do if somebody says, no, I'm not going to get tested. I don't want that. It looks painful and I don't believe I have it, so I don't want to take this test. You'll need to figure out, what do you do? Is that a condition of employment? Can they not come back to work if they don't do the testing? You also have to have a pretty solid policy for when they can return to work after they've tested positive. Do they need to have a couple of negative tests as a result? How long? How far apart? How long do they need to be out for? All of these questions you need to be asking and be prepared for before you do this. The final thing, and this is why I'm going to tip my hand and say I think it's a terrible idea to do this testing, is let's say you test and you just determine that there is an asymptomatic person in your workplace that has tested for COVID. You now have a potential work exposure, and this does get to the question of liability, which I know a lot of employers have been worried about. If we're bringing people back to work, what is my liability? Well, a lot of folks, and I'll talk about it a little bit more in a bit, but a lot of folks have been guided through legal counsel by saying having an employee determine that they actually picked it up at your workplace is going to be a really hard exercise for them. So there is a little bit of protection because it's in the community. So how do we know you got it at work and not on the subway on the way to work? Well, if you test and determine that you have an infection in your workplace, then you also have that liability. So my other flip side says, yeah, but we want to know if there's somebody who's sick at work and we want to deal with it. Of course that's true. But testing, we've seen it in the White House. Just testing does not mean that people will not get COVID. It's just a determination of whether they have it. So a lot to think about here. Proceed with caution. If you want to take the temperature, it's only minimally effective because obviously half of people don't have any symptoms on this disease, and it can be remediated with an aspirin or a fever reducer. So taking the temperature is not a particularly effective means for it, and the CDC said you can do it. It's just not going to be that effective. Some states require it. Some counties are requiring it. So it's a mishmash of rules around taking the temperature. But what I will tell you is I have heard from employees that they take their temperature every day and it gives them peace of mind. And I got to tell you, if taking temperature gives anybody peace of mind in this day and age, I say do it. So, the goal is to is to get through this period of time with as least stress as possible. If somebody gets sick, I'm revisiting this because this is really important and you need to follow the CDC guidelines, but if somebody gets sick, they should not return to work until they are fever-free for at least 72 hours without the use of a fever reducer, and they have improved respiratory ailments such as coughing, breathing, their better respiratory condition, and it's been at least 7 days from the onset of symptoms. This gets really confusing. For example, a lot of people, had a fever for 2 days, fever broke, they're feeling better, they want to come in. Well, they can't, and it's been 72 hours since their fever broke, but it hasn't been 7 days since the onset of symptoms. So you need to follow all of these things. I had a case with an employee who wanted to come back to work. Her daughter had been home with a case of COVID. Her daughter was better, and so they wanted to bring the mother back to work. And I said, whoa, whoa, whoa. You can't bring her back to work until she has been through her own quarantine period, which means what was the last day that that child was contagious, and then you start your 14-day quarantine period before she can come back, or you could get her tested. So the decision tree on these things is really, really complicated. But if they did test positive for a COVID, they need to then get 2 consecutive negative tests once they are over, and those tests have to be at least 24 hours apart before you should return them to work. We have had cases of employees, and we saw a huge aircraft carrier in, I think it's Guam, where people tested positive for COVID, they tested negative for COVID twice, they went back to work, and they tested positive for COVID again. This has happened with our clients. It's happening around there. So these conditions are coming back. So you need to keep, and we don't know whether that means that they're contagious when they're on their second bout or if they're symptomatic on their second bout. The ones that I've dealt with, they were symptomatic and then they went back home again. But you need to have your policies in place on what to do. And again, if somebody shows up with a fever, we don't know whether that's COVID or whether that's the flu or whether they just picked up a virus, some other virus somewhere. It doesn't matter. If they have a fever, we're treating it as COVID. We are following these policies regardless. If they have any of the symptoms of COVID, send them home and follow these guidelines. Remember, in all of this, you need to keep them private. So you need to tell your workplace that there was an infection, especially those who work within 6 feet of that employee. You may need to remediate that workstation or the building, depending on where they were, but you cannot say who it was. So you need to keep that confidential. We all know in a workplace, the rumor's going to go around. They'll figure out it was Steve. Yeah, it was Steve. But that cannot come from you at all. You have to keep that private. So that's a big commitment that you have, and you need to keep all of the documentation. This is a time when you need to keep all documentation about everything, about these symptoms, about your testing, about your policy, about when, and all of those testing results need to be under lock and key and private. We at Affinity HR Group have put together a COVID checklist for you if you're returning to work, and it covers all of the different categories of work, from posters and protectional equipment to how to clean common areas to a wide variety of policy changes that you need to make. It's on our blog, and we've also sent it to all of the associations that we partnered with. So you can check out our affinityhrgroup.com/blog for this, and you can download it, or check your association's COVID resource page. It is there as well. We just finished today and sent out to all of the associations that we work with a return to work policy. So it has all of the categories of policies that you may want to put in place when responding to, such as PPE use, when to go home, when to come back, what documentation you need to be using, the Federal Response Act, Coronavirus Response Act, medical leave, paid leave, family leave. So big honkin' policy that has a bunch of criteria. Again, how you set back up, how you structure yourself is entirely going to be dependent on your own workplace. So it's really a resource for you to kind of customize that policy as you see fit. Email me at Affinity, Claudia at affinityhrgroup.com. Again, check our blog, check your association site, and we can get all of these documents to you for free. So other considerations, this is the new stuff that's out there. The first is you need to, at this point in time, revisit your folks who are out on emergency paid family leave. Those who are home taking care of children, because of two things. First of all, school is out or closing soon. What were their plans for the summer in the first place? Are those plans available? What were you going to do with those children in the summer under normal circumstances? And you need to have them resubmit that form if they need to continue to be on that leave. Also, we have a lot of folks who their daycares have opened up, and so now you need to keep coming back to that stuff. If they stay home with a child and their daycare has opened back up again, that will not be reimbursed by the federal government because appropriate child care was made available. So you need to be in close communication and revisit all of those forms and policies and keep up to date on it. Keep your documentation of requesting that information. You need to keep all of that stuff. We also are seeing a lot of cases of employees who are afraid to return to work because of the COVID, and it might be because they are at a higher risk, or it may be because they're just afraid, or they live with somebody who's at risk, or, you know, obviously parents of small children would be concerned about putting their children in a daycare facility. You need to have those conversations with them. I would tell you to be as empathetic with them as you possibly can. It's a scary time. We're all scared, and we're all walking around with all this like stress on top of us because we have no control. We don't know when it's going to be over. We don't know if it's going to get us. We don't know how to keep it from ourselves. And all of our governmental entities that are supposed to keep us safe are not really, like, we're kind of flying blind here. So what I would recommend is that you have empathy with them and you have that communication. But if they're just afraid to return to work, they will not qualify for any of the federal subsidized paid leave. If they've exhausted your PTO, then, you know, you can decide whether to let them stay out. But they need to know that if you lay them off, or if they quit because they don't want to come back to work, they won't qualify for unemployment, because unemployment is for those who don't have work available to them. These are folks that do have work available to them. So I don't see many state unemployment boards approving folks who want to stay home beyond the leaves other than because they're afraid. And again, I get it that they're afraid, but you need to have those communications with them and make sure they know. I mean, I'm sure they would all love to be picking up that extra $600 a week under unemployment, but that is only for people who don't have work available. And as the states are opening back up again, they're all revisiting those unemployment claims. And finally, that $600 goes away at the end of July. So it's not a long-term solution anyway. You should revisit your PTO policies. A lot of companies are having to be creative because we've all been stuck in our living rooms, so we were essential, so none of us have been taking vacations. Also, where can you go? So that means that a lot of folks have a lot of banked PTO. What to do with it? Well, you can be creative. You can make this up as you go along. You want to have a special 2021 COVID rollover payout. You can put it in a pool. You can donate it to somebody who needs to stay home. There are lots of creative things that you need to do with that policy, but you should be thinking about what to do with your COVID policy. You also need to think about the legal liability of opening back up. I've had a lot of conversations with a lot of insurance agencies. I'm very deep into the Insurance Agency Association space, and these are entities that they all, pretty much every single one, works on a client management system, an operating system that can be accessed remotely. So they can pretty much all continue to work from home. And we've seen a smattering. We've seen even some of the associations saying, I'm not even going to, we're going to get rid of our building. The association itself is going to go remote because they can. And they've been able to see their productivity, and there's a lot of productivity data in their CRM. Not every business is like that, of course. But if you're bringing folks back and you don't have to, or if you're bringing folks back and you do have to, or if you've had folks in there all along, what is your legal liability? Well, we talked about it a little bit about, you know, can they prove that they got sick from you? What I will tell you is that there's no definitive answer on this. Congress has been kicking back and forth whether to provide some liability protection to businesses during COVID times. A lot of states are having all COVID things go forward on the workers' compensation as a means of paying and tracking COVID, but not putting it back as a legal liability on your own workers' comp premium. It's just a mishmash all over the place. But what I will tell you, I know for a fact, if you are vigilant about keeping your workplace clean, if you are having people socially distance, you're taping your floors, you've created the physical barriers in space to protect against sneezes and things of that sort, if you're having them wear and you're providing them with personal protective equipment, the stuff that they need to keep their workplaces safe, if you're vigilant about it, if you're taking their temperatures, then you can at least show good faith to protect your employees. It's those that have no regard and disregard their conditions entirely. Those are folks, if they get an infection, I think they are riskier. I think there is a stronger ability to say, look, 9 people in this office got COVID. It was here. You didn't protect us. You didn't do this, this, and this, and therefore liability claim. So keep an eye out on that, but you should look at the efforts that you do to keep your employees safe as that safeguard for legal liability, and talk with your attorneys about it, of course, what you need to do in order to bring employees back safe. What I have heard attorneys say is just having them sign a form say they will not sue if they get COVID at work is probably not a sufficient protection. Finally, the folks have the PPP loan, and those are just beginning. The beginning of June is when folks are going to be applying for that loan forgiveness after that 8-week period. It started April 3rd, and so that's going to be coming up here pretty soon. The Small Business Administration released a loan forgiveness form yesterday. My brain went poof when I read it. It just was like, oh my gosh, this is going to even be harder than applying for the loan in the first place. And there's still a lot of questions that are out there. The one thing that they did do in issuing new guidelines is it originally was 8 weeks from the day that you originated the loan, the day the money showed up in your bank account. That's the period, but they've allowed some latitude for it to actually be consistent with your pay period. So you can move that date a little bit so that you can show the actual payroll on the days that make the most sense within or around that 8-week period. Get with your accountants, get with your CPA on that, and if it looks like you might not make it, we've had a lot of clients give that money back. They thought they were going to have significant financial hardship, and then in the end they didn't. And that's what's so weird about this. There's some real winners and real losers in this economy the way that it is, and those who are winning financially speaking didn't necessarily know that, got the loan, and now are returning it. So these are all decisions that you should be making here with your tax folks. Finally, there are new issuing guidelines for COBRA. So you need to get with your health insurance provider because they have extended the COBRA notification period. If you got laid off, you have until 60 days from the end of the pandemic to enroll in COBRA. So even if they didn't sign up right away after their termination, they now have a much longer time to sign up, and you'll need to provide that notification to employees when they get terminated, and you should get with your health insurer or your benefit provider to get that notification. Also, with the market economy, I haven't even looked at my 401k and my IRA, I'm afraid. I literally have not looked. And you might have some employees that are in the same position, or they may be wondering what they should do with their 401ks. What I don't recommend you do is say what you're doing, because you don't know what their portfolio looks like. You don't know how long till retirement, what their retirement plan is. So now would be a great time to set up a Zoom call with your 401k provider to talk about the market economy, to talk about the different funds, to talk about what they should do. A great resource you should be providing to your employees. One other thing that you may want to be thinking about is an employee assistance plan. There have been jokes about people, drinking to excess while they're locked in their home under COVID. It's a real thing. People who have or lean towards substance abuse and addiction are really, really struggling with the isolation, with the lack of structure, with the lack of distraction. So, and there are those folks, if they've had some mental health challenges, they've had some depression or anxiety, like, welcome to anxiety heaven. So think about getting an EAP, an employee assistance plan, and they are all over the place. They're not very expensive, a few dollars per employee per month, and well worth it given kind of the deal that's out there. Finally, if you're going back to work, maybe a little celebration. Come up with some creative ways to celebrate virtually if you can. Give them a coming back gift. Spend some time sharing what their experiences have been like. If they haven't been together, what have they done? How have they spent the time? What were their most wonderful moments? Celebrate being together again, because this has just been really hard to be so socially isolated. Again, please do it outside in a parking lot 6 feet away from each other. Get as far apart as you can, but even if you can figure out somebody creative there, somebody on your sunshine committee or somebody who is your sunshine committee, think about a way to celebrate coming back. Buy them some swags. I survived, our company survived COVID 2020, whatever. Do something to celebrate what we've all been through. It's a universal experience. Finally, we have put together a prepaid hour. It's an HR support hour unique to COVID. It's a discounted hour off of our normal rate, so that you can use us to help triage some of the questions that you'll have around policies, around opening back up, around dealing with the situation, around dealing with a leave request, or dealing with somebody who gets sick. The minute somebody gets sick, that decision tree is massive. We've been through it. We've been around the block now. We've been around a lot of blocks now. So we're here to help you, and you can take that hour in very small increments so that you have a resource you can keep coming back to. And again, our blog, we have the return to work checklist, and we also have the return to work sample policy for you. So that is really kind of what I was going to share with you. Again, my name is Claudia St. John, and I would love to take your questions. Please, please, please ask me some questions.
So we've got, excuse me, we have one, and it's just want to make sure that this information is available, because you mentioned earlier about your resources for policies and tips and stuff, and somebody asked, does that cover janitorial policies, or is this like basic office stuff?
The policies themselves are around your employees, so their need to keep their workstation clean, but the detail is kind of left out because, again, how you're handling that is going to differ. But it's around testing, it's around PPE use, it's around sanitation, it's around PTO use. It covers a lot of those things. It covers things like traveling to client sites, scheduling visits. It has a whole bunch of different sections. The checklist also has a lot of suggestions around how to protect and clean your workplace. And again, we also have in that checklist a link to the federal resources that we recommend that would include OSHA and the EPA, which have issued a lot of guidance on how to sanitize and protect and clean your workplace. A lot of folks are also still trying to figure out where to get their PPE. I think it's getting a little bit better now. And likewise, their cleaning products, those are I'm beginning to see them back in the grocery store, although I went to go and get just a pump of hand soap for my sink, and those were all out. So it's just so strange how our supply chain is so completely disrupted. But if you do select a janitorial company, if you do work with a janitorial company, I know a lot of them have been selling some of the cleaning supplies that they have been able to procure from their distributors. And also you should talk with your suppliers within your industry. For example, if you're an oil change or a car wash, a lot of the chemical providers for those industries are also now providing cleaning supplies and protective masks. Likewise, a lot of promotional product companies have shifted from swag. We're not going to conferences and handing out pens anymore. they're now getting PPE and cleaning supplies. It's where I got my hand sanitizer, which is right here. I had to get my label on it, but I have 100 of these suckers because I could not get any hand sanitizer. So your promotional products companies should be able to get that for you.
That's great. You're so set on
More
hand
questions?
sanitizer. That's all the questions that we have at the moment. That was the only one that we had come through. Yeah.
I would like to know, what are your biggest challenges that you're having out there? What are the biggest concerns that you've had? What really awesome pieces of advice can you recommend to others? How have you handled it? I would love to take a minute just to share a little bit for those of you who are taking the time to be here with me. Share, please.
One person has commented that unemployment has been challenging.
Yes, so unemployment has been challenging, and you know, it's a state-by-state thing. I think there's a lot of good workers out there now that weren't out there before, but you're also trying to hire back people when they can get a really solid unemployment claim. What I understand is that if you have work available to your employees, the unemployment is not going to be available to you. And if you furloughed them and are bringing them back, you should notify the unemployment board that those employees that you furloughed now have work available to you to bring them back. They may not like you very much after you do that, but I definitely know it is a challenge. But I will promise you that it will get a lot easier at the end of June or the end of July when that $600 goes away. And I also know that it's a state-by-state thing. And you know, these systems, these unemployment insurance systems, these are on websites that were developed, like they're having to bring COBOL developed programmers back from retirement because they developed these things in the 1980s and haven't revisited them since. And they are not equipped to handle, you know, 30 million people all of a sudden unemployed. So unemployment has been, yeah, a disaster on many, many, many levels. But I would just keep promoting it and know that it's going to get a little bit better at the end of July.
Yep. We have another comment that says about engagement, employee engagement. Says we've been trying to keep spirits high with company spirit weeks, different activities for engagement, and to keep minds off of COVID-19 for a few months.
That's excellent. And if you would email me and let me know what you've been doing, I've been getting a lot of requests. I've been getting a lot of press reporters calling on ideas for employee engagement in a virtual world. And I would really, really love if you would send me some of those ideas. And I do think, you know, it's funny. I keep thinking that I am in my own little silo and having my own experiences, and I decided to start baking bread. Well, then I couldn't get any yeast because everybody on the planet is baking bread. So then I decided to do sourdough because you don't need yeast for that. It turns out everybody on the planet is doing sourdough. And I wanted to do some puzzles. All the puzzles are sold out because everybody on their planet is doing puzzles. And I just read an article that said that people are not doing their dishes, and like their dishes are totally piling up, and they're getting to the point now where they just wash the dish or the plate or whatever that they need. Otherwise, they just let them stay in the sink because we're all eating 3 meals and we're over it. And I have a sink full of dishes right now. So we're all living through the same thing. We're all going through versions of exactly the same thing, and we're having our same anxiety. I think sharing, creating community, creating opportunities to share, you know, having a video day to like whose kid is doing what wonky thing, what dog mishap did you have? I was on a webinar with a woman, and she had a blue tick hound that apparently caught a mouse in the house on the other side of the wall, and it sounded like there was a murder going on. You know, life is just funny and odd, and I think the ways that you can find to share and celebrate with each other, that's how we're going to get through, is trying to find community and be there to support each other.
Yeah. I remember when this all happened, I heard about a German jigsaw puzzle making factory that actually didn't have enough people to make puzzles. They were backed up because people were ordering them all the time. So anyway, we have a couple more things. We have one person who's based in Michigan. Their comment is that they're having difficulty dealing with the government agency guidelines, and they might actually continue to remote work for some time while they move through all of that.
Yeah, I've heard that in Michigan. I've heard that in Chicago and Illinois as well. You know, it's really a mishmash. I think the folks who have been working successfully, who've been open through this and have been working remotely, some of them just want to bring everybody back. And I scratch my head on that because I don't, you know, it still is not a particularly safe time to do that. And I've known businesses that have required that their employees have their video camera on at all times so that he can zoom in and check in on them to make sure they're sitting at their desk doing their job. You know, I'm over that too. I think making those decisions about to go back, about to stay home, you know, my bias is if you can keep them home until we know that these infections are not just going down, but are not around. And in most cases, you know, here we still have COVID infections. We don't have that many people in the hospital anymore, but it's out there. So why risk it? So I would just ask you to take that into consideration. And I also, I think you're better off not jumping the gun if you can work from home, if you can work remotely. I was talking with a printer this morning, and she said they've worked on staggered shifts. So they've created a 2-shift, and they work 3.5 days on, and then they have their other shift work 3.5 days on, and they've been but they've been really long days. But that way they're only at half of the capacity, and they've been doing fine. And she said, I'm just going to keep doing this. I don't see any reason not to. It's keeping us safe. So it's a personal decision, but I think if you have those concerns or the regulatory wonkiness, and it is wonky, I would err on stay put and stay safe until you know it's going to be better. Your employees will appreciate that for you.
We have one question about the PPP loan, I think, or the PPA loan, excuse me. And it says we have 8 weeks to repay that loan, but our payroll runs twice a month. Do we have 2 months to spend that loan on payroll?
So it's 2 months. It's 8 weeks. So and what you can do is start from the first day of your payroll and go through the 8 weeks. Okay. Of your payroll. So yeah, and that was an accommodation that they made because originally it was just on the date of origination, and that fell randomly, right? So it fell in the middle of payroll for most people. So now you can do it from the date of the payroll. The form I just got from my banker for our paycheck protection loan, the Small Business Administration just sent it out. You know, it really is like, I looked at it and I just thought, I don't even want to read this. I wanted to prepare for talking with you all here today, and then I thought, I hate this. This is confusing. I don't know what data they're looking for. It just kind of like literally blew my mind. And so check the Small Business Administration for that fun experience. Hopefully it won't be as daunting and frightening and frustrating for you as it was for me.
Completely understandable. That's actually all we have for comments and questions right now. So yeah.
Excellent. Well, thank you all. First of all, thank you, Stephanie. I appreciate you, and I appreciate all you do to do these. These are a lot of work, and I can't wait for the day that we're not going to talk about COVID, and we're going to talk about hiring, and we're going to talk about onboarding, and we're going to talk about employee engagement. We're going to talk about so many amazing things, and I cannot wait for that. And in fact, actually, I have been having all of those conversations recently. Folks are really, you know, from my desk, I see a lot of activity out there, and it's very hopeful. And but in the meantime, know that we're here. We've got these resources for you. There's a whole video library up on YouTube for you to go back and take a look at. But you need to keep revisiting these policies. You need to keep revisiting these practices. You know, we're expecting to see a return of this in the fall if this goes away. be prepared for that. You know, hopefully we won't be all caught so blindsided with loss of the lack of supply chains for our cleaning needs and our health protection. But know that we're here, and we would love to help in any way we can, whether it's the COVID hour or just to, you know, just a call with a question, because Lord knows everybody seems to have them these days, because this is just never going away. It's endless. It's COVID horror. But anyway, I'm grateful for all of you that came today. Thank you so much for participating. Thank you, Stephanie, and I hope that you all have a safe and productive work week.
Right.
Take care.
Thank you. Of course, thank you. Thank you so much, Claudia. Everyone, before you leave, please, we'd like to gather your feedback on today's webinar content, so please take a moment to respond to the poll questions on your screen. We will be following up with a recording of today's program. So thank you so much for attending today's webinar, and you have a great rest of your day.
Thanks. Bye.